All right, viewers, welcome to Mirror Prime. It's me, Ashish Pareek. Let's quickly begin with some breaking news that's coming in right now in connection to the Haryana Assembly election results. The poll panel and election commission has rejected the allegations from the Congress. Poll panel has also cautioned the Congress. It has warned the Congress of public unrest and chaos. It has asked the Congress to curb its tendency of frivolous complaints. Very strong words here being used by the election commission against Congress, which had alleged some sort of a discrepancy as far as election results are concerned. Niyamika joins us on the broadcast to get us more details on this. Niyamika, you've been covering all the details as far as the assembly elections are concerned, and Congress, it has become a pattern of very conveniently questioning the election process of the states where they lose an election. But now the election commission using very strong words and asking Congress to curb its tendency of filing frivolous complaints.
Absolutely. As if you remember, then the Haryana Assembly results had come out in which the Congress party had been defeated by the BJP, and for that reason, we have seen that how the Congress party had blamed the Election Commission of India as well as the EVMs regarding the numbers which have come out in the Assembly election results, and they had also submitted two of the memorandums to the Election Commission regarding the irregularities which have been allegedly reported at 20 various locations within the state of Haryana, and now a very strong-worded letter has come in response of all these memorandums and the allegations which were being leveled by the Congress party, as it is the Election Commission of India which has written a letter to the Congress President Mallikarjun Kharge in which they have alleged that all these irregularities which have been alleged by the Congress party are completely baseless, misplaced and devoid of any kind of facts. In fact, the Election Commission has also cited that the Congress party should refrain from making any kind of baseless allegations after elections, as it has also called out the party of raising smoke of generic doubts and urges the Congress party to take firm and concrete steps to curb such kind of tendency, as it has also mentioned in that particular letter by the Election Commission that such kind of allegation can create chaos amongst the people as they trust upon the Election Commission of India and the EVM. So such kind of allegations shouldn't be made by any of the political parties. So this is a very strong worded response which has come on the part of the Election Commission after the Congress party had claimed that at 20 various locations in the state of Haryana, there were some kind of discrepancies which have been reported, as they have also mentioned about the batteries of the EVMs, as they have mentioned that in those particular areas where the EVMs were having 99% of the battery, and in those areas only the BJP had got a large number of votes as compared to the Congress party. So all of these questions were being raised by the Congress, but now the Election Commission has said that this is nothing but just a baseless allegation which they are trying to make after they had faced a defeat in the Haryana Assembly polls.
All right, Niyamika, appreciate you joining us on the broadcast. So very strong message being sent out by the Election Commission to the Congress party, which of course has almost made it a habit now of questioning the election process of every single assembly election or even the Lok Sabha election that they have lost. And of course, strong words there being used by the Election Commission. Meanwhile, viewers, let's of course shift our focus to our top story this hour. As Diwali approaches, you can of course almost smell the sweet treats in the air. But here's the catch. There's a dark side to all that festive joy as well. Just look at what's happening across the country. Maharashtra's FDA has now seized an eye-popping 24 lakh kg of adulterated ingredients since August. Nagpur alone accounts for 22.68 lakh kg of that, and this of course is a reminder that when demand for sweets skyrockets, so does the shady business of food adulteration. Take Mawa for example. It's a must-have in many Indian sweets, but it's almost now become a prime target for those trying to cut corners. The FDA's inspection have found that people are mixing khoya with some really hazardous stuff like vegetable fat, chalk powder and even blotting paper. It's not just happening in Maharashtra. Over in Madhya Pradesh, officials have also seized 1,600 kg of adulterated Mawa. In Ujjain, they found another 300 kg just days before. And of course, in Agra, they have also caught 750 kg of adulterated Mawa. This, viewers, is a nationwide issue and it's a real headache and it's a massive concern. We'll be discussing this with the experts now on Mirror Prime. Mahesh Zagade, who's an ex-food commissioner from Maharashtra, Dr. Sanjay Indani, who's a food safety expert, and Dr. Shikha Sharma, who's a senior nutritionist. Mahesh Zagade, I'll start with you. As a kid, of course, I remember being excited about sweets during Diwali, and I've realized with all these stories of food adulteration, I'm now simply happy settling for simple homemade sweets. And I'm sure this is the story of crores of Indians like me.
Ashish, it's good that you're airing this story across the country so that people will be aware of what is happening. But let me tell you, this is not the first story. Many Diwalis and many festive seasons in last, I don't know how many years, maybe 4 or 5 decades it's going on. There was a law called Prevention of Food Adulteration Act 1954. And that law, although the word prevention was mentioned in that, it did not do any good to prevent adulteration in the food. So they thought that since the act was not good, so they made comprehensive changes and brought out very omnibus, very effective law that is implemented from 2011 onwards. That is Food Safety and Standards Act 2006. And now it is 13 years it is in place. Now, the main issue is here. Every year, we get to know such stories that so-and-so FDA, so-and-so food commissioner, they have caught so much of consignment, which is adulterated and all that. And it is repeat every year. And people are consuming. This is number one. Number two, that doesn't mean that they have caught each and every kilogram of koya or whatever the adulterated material is there in the market. No, this could be just tip of iceberg. So it cannot be solace for the people that so much quantity has been caught and it is now going to get destroyed. No, that's not enough. The law is very important from the point of view of health of the people. Now, this new law, which is in place for last 13 years, what it seeks that the official machinery should be so cognizant about all these things that right from the manufacturing, like say koya, when the milk is getting converted into koya at a very smaller places, those places smaller, like maybe 10 kgs or 20 kgs, whatever smaller, they have to be registered compulsorily. And then that chain has to be like, when it is transported, say on cycle, or in, say, small tempo, or a rickshaw, or auto, that is also to be registered for transportation of food. And from there, like, say, wholesaler or retailer or manufacturer and everything. So it's a chain, watertight chain is established, and that chain has to be maintained by the Food Safety and Standards Authority of India at the national level, and every food safety commissioner at the state level, who is the officer of the rank of secretary, being an IS officer, and right up to the food safety. But this mechanism has failed miserably. They have failed the law and they have failed the country. Now, just simply say that we have caught so much doesn't mean anything. It's like earning brownie points that we are doing so much. There, the heads have to roll down, right from the Food Safety Authority of India to food safety commissioners and at the officer of the district level, if so much is being caught. And it's not just during the festive season. Whole year they sleep. They have to put the machinery in place and monitor it 365 days and 24/7. They are not doing it. And then probably the health of this country is at risk.
Absolutely. Maheshji, very interesting point that you're talking about, the fact that there's a new law in place. It's a very stringent law, but nothing seems to change. Dr. Sanjay ji, you're a food safety expert yourself. Year after year, such seizures happen. We continue to talk about food adulteration. We continue to show it on our news channels as well, but nothing seems to change on the ground. Are the laws not being implemented properly? Are the officials too corrupt? What exactly is happening on ground?
Yeah, good evening, Ashish, and I'll take this opportunity to wish you a very happy Dhanteras and a happy Diwali to all viewers also. Right. As mentioned by Jagdish sir, yes, the law, stringent
Sanjay
law
ji,
was,
you're wishing me Dhanteras and Diwali. You don't have to offer me sweets for that.
See, what is important? So, right. See, basically what happens whenever there is a gap, okay, between demand and supply, okay, this kind of things happen, as mentioned by Jagdish sir, like decades have gone. The new stringent law has come, but what is important is the implementation grounds, okay. the people should be available, like FSOs should be available. Now, if we are running in Maharashtra about 400, 450 FSOs across Maharashtra, it's really difficult for them to reach to the places and to monitor those things, okay? So everything should be equipped. It is not only the law which will be responsible, or rather it will happen automatically, okay? Everyone, including the politicians, commissioners, okay, FSOs, everyone is responsible, and they need to be equipped. So there is a demand today that the people should be aware, people should be involved, and the people should be supported. The staff should be supported with all the facilities. I think that is one part where there is a gap, okay? And certainly the awareness is increasing, but it is always, if you see, there are two sectors. Okay? One is organized and second is unorganized. So unorganized sector will always take this chance of the festive season or any opportunity of doing business and creating a shortcuts and making more money. So what is important is to control this unorganized sector, and this unorganized sector operate at a very low level, at very remote places, and to reach that place is very, very difficult. As mentioned by Jagdish sir, yes, every chain in all FBOs need to be registered, need to be licensed. And those who are registered, those who are licensed, they are still improving. So if you see past 10 years, 15 years improvement, okay, there are a lot of changes happened. There is a lot of awareness, and the testing is happening. Okay, the people are complying to good hygiene practices. Packaging has improved. The transportation has improved. So a lot of improvement has happened. But these kind of lacunas will always be there, because these shortcuts give more money, and the unorganized sector will work for that. So that is what we need to curb. And as a consumer,
Absolutely.
if you
All right.
ask,
like
we
you
have
rightly
to
pointed out, Dr.
really
Sanjay,
look
this is
for
a
not
deep-rooted
a
issue,
sasta
and
kind
of course, a
thing.
lot needs to be done to ensure that this is solved as well. I'll take this point across to Dr. Shikha Sharma, who's also joining us. Shikha ji is a senior nutritionist here. Shikha ji, the problem is today when we talk about adulteration, a lot of people think that theek hai, thoda bahut color dal diya, thoda bahut changes kar diya. But the problem is these people are using chalk powder, they're using detergents, and these are happening at a very large scale. We're talking about thousands of kgs of Mawa and such items, adulterated items being recovered. So when all of this goes inside a person's body, what are the sort of damages that it can do?
Right, like urea is being added, detergent is being added, chalk powder is being added, paper pulp.
Absolutely.
Paper is being added.
Shikha ji, sorry to interrupt you. I also heard about this, the fact that urea is one of the most commonly used agents for adulteration. And I was shocked when I saw this.
Absolutely. Now, what will happen? And even hydrogen peroxide is added. Now, hydrogen peroxide, even in hair colors, people are not using because it damages the scalp. So imagine you're directly drinking that hydrogen peroxide milk or hydrogen peroxide, adulterated foods item. So what happens? Firstly, this will damage the intestine. The intestine has a very sophisticated immune system, and it's a network of nerves. So when your immunity is damaged, all those health problems which we see in winter start popping up. Whether it's allergy, asthma, blood sugar problems, all of them. Then at the level 2, it goes into the liver. So today, if you see that how many people have fatty liver, it's not that everybody is having alcohol. A very small portion is having alcohol, but so many other people are having fatty liver, thanks to all these adulterants. The third level where it goes is basically the heart and the lungs, because allergies, asthmas, skin problems, and in smaller children, and especially pregnant women, it also leads to nervous disorders, nerve-related disorders. If you see, a lot of kids have things which are made of these adulterated milk products and adulterated other, which are mostly the sweet range. And then when they come to the doctors with diabetes, which is at a very young age, when they come with allergies which are unexplained, there are no explanation for those allergies. When they come with lactose intolerance, gluten enteropathy, kidney problems. I mean, if you see the number of dialysis centers which have to support kidney patients, it's not only insulin, it is also all these adulterants directly damaging the kidney. Because at the end of the day, whatever we eat has to be eliminated from the kidney and from the intestine. So we are living in a chemical food condition. We are living in a condition where there's so much chemicalization of food. that the body is not able to handle these chemicals.
Absolutely, Dr. Shikha ji, the fact that you're saying we're living in a chemical pool, it just sounds scary, but not very surprising, because I even saw a research study, I haven't quoted it yet. I saw the fact that it was published, I think, on NCBI, the fact that 80% of the food in India, across all categories, 80% of it is adulterated. I'll of course go across to Mahesh ji here. Mahesh ji, again, we talk a lot about adulteration, especially during this particular season. But when it comes to food issue, when it comes to food, when it comes to various other items that we consume as well, what exactly happens here? How is it adulterated? Now, we talk a lot about being proud as Indians. Even I'm a proud Indian, but the world really laughs at our civic sense and also the lack of hygiene standards in India. What needs to be done? Because clearly educating people about it isn't working. What more should we do?
Ashish, one thing I agree with Dr. Shikha ji also. It is not just the chemicals that are getting added. I would go a little further, and it is like assault of chemicals on human bodies and minds in India, and of course many parts of the world. And what are the medical problems we are seeing could be emanating from either the food or the adulterated or spurious medicines. So that is the story. Now, we Indians, for that matter, or anybody, any citizens of any country, they are not supposed to be like, we have a civic sense and all that. It's all like cleanliness, everything. But when the traded food is coming from other source other than my own kitchen, then it has to be of good quality, and that is the duty of the government, and it is coming from the directive principles of the Constitution, that it is the duty of the state to protect the life of citizens. And this law, Food Safety and Standards Act, also says that it is not just the quality of the food there, it is the savior of the people. And therefore, I am again saying that whatever is happening in this country about the food, it is not just during the festive season. This could be we talk about this happening, but it is happening all the time, as I said earlier. So country needs to rise to this in the sense that they should be aware that these things are happening day in and day out, and they should question the machinery, they should question the people's representative. What are they doing? You're asking for our votes. What are you doing to protect our lives? Nobody is asking this. And if nothing is happening, then people are complacent and they are making huge money profit out of this at the cost of people's lives. Now, what people have to do, they really, I keep on hearing that how to test khoya or the Mawa, you say, and how to test. Who will test it? The adulterants are such that nobody can do much about this. The adulterants are very, very difficult to test. And if you take a survey, how many purchasers have tested it? Probably it will be in fraction or may not be on fraction also. So that is like, theoretically, it's okay, you do this at home and then you do it. What is important is that the corruption in this industry, the governmental system, Dr. Indani has said that machinery is, inadequate. I was Food Safety Commissioner for Maharashtra for 3 years. I exactly know that within the given machinery, you can do wonders if you put them in place. So the corruption is the root cause of all these things. It is not that the people are bad, the manufacturers are bad, suppliers are bad. They can be controlled. This is if we go to USA or many European countries, see, the stringency comes from the enforcement of law, and that law enforcement comes from the transparency and corruption-free administrative system. This country should realize that this is the root cause of the food adulteration and nothing else. If they start doing cracking their whip from tomorrow, things will start improving in a month or two. That is there. But country should realize, not that like who should do what and who should not. Corruption, and I would not attribute this corruption to the political level. This is happening at the implementation level. And then like the secretary of the
Absolutely. Mahesh ji, this is a deep-rooted issue. I think that's the biggest takeaway of this entire discussion. The fact that it's happening at such a deeper level that multiple agencies have to now get involved. And also, like you rightly pointed out, we speak a lot about detection methods. For example, I was asking someone, how do we detect something that's adulterated? They told me, you have to use a test tube and everything. And I'm thinking, if I go to a sweet store, if I go to buy sweets, I wouldn't carry a test tube with me. I look at the sweet, I like it and I buy it. I mean, the fact that you need to be concerned about that so much, it's just upsetting. Before we wrap this discussion, Dr. Sanjay ji, I only got a minute on the broadcast. What do I do? For example, if I have an adulterated sweet that I've brought, or if I know of an incident that's happening of adulteration, how do I report it? Who do I report it to? What exactly is the action that I can take?
See, there are multiple portals where you can report. The very first is the state FDA, okay? And once you report to state FDA, now as a consumer, I have right to take the sample and send it for testing at my cost. Okay, if as a NGO or something I want, okay? Otherwise, okay, I can report it to FDA portal, or FSSAI has a dedicated portal, dedicated line where the report can be given, reporting can be done, or the photos can be uploaded. There's a WhatsApp number where you can send the image and send the message. So all said and done, all this is there. The regulatory authority is handling at least thousands of complaints every day. They have a dedicated, you can say, a team who will be taking care of that, and the root cause and all those will be evaluated. But as a consumer, I should not go for an option which is cheaper, particularly in this festive season, because if I do go for unorganized, unpacked food, loose material, where I don't know the brand, okay, there is no proper labeling, at least that I should be making out. And there is a lot of money being spent by government, almost 25 lakhs of people, those who are working in industry, food safety supervisors have been trained. A lot of training campaigns have been done right up to Anganwadi. So I think the authority is working on it. It's not that you just change the card and everything will change. Okay. So as mentioned by Jagdish sir, he was
the apparatus, the state apparatus is working on it. How efficiently are they doing it? That's a big question. And of course, it is sad that we are sitting here and talking about it during festive season. We should, of course, be talking about the different kind of sweets that are available. But here we are sitting talking about the kind of adulterants that are used. And I think, of course, a lot needs to change as well. We talk about civic sense. We talk about hygiene. I think these are changes that, of course, government can do a lot about. But at the end of the day, it has to come from within. Mahesh ji, Dr. Sanjay and Dr. Shikha, I appreciate you joining us on the broadcast here on Mirror Now. Very important discussion during festive season. Of course, we'll be joining you back with lots more viewers. On that note, it's a wrap on this edition of Mirror Prime. Lots more lined up on the other side. Stay tuned.